Hello, great city of Brooklyn. Hello, friends of Brooklyn. I'm Michael Palcisko, and it's that magical time I'm going to get a colonoscopy. And what better place than North Shore Gastroenterology and Endoscopy Center. I'm ready for my colonoscopy. I'm here with Dr. Vohweiler. It's an honor to be here with you, Doctor.
Thank you very much.
I want to talk procedures. What are some of the procedures that North Shore has?
Okay. Well, we actually have 11 gastroenterologists on staff, and all of us do a variety of routine basic endoscopic procedures. That includes things like upper endoscopy, what we call an EGD, and also colonoscopy. That's the basics of what we do through all our procedures, and all our doctors do those things. That's looking inside the stomach to look for conditions like stomach ulcers or bacterial infections like H. pylori. And then colonoscopy is done more routinely to investigate symptoms like diarrhea or blood in the stool, or as a preventive test to prevent colon cancer. We do a variety of advanced procedures as well. There's one called an ERCP, and that's done to investigate areas like the bile duct and the pancreas. And we do some other advanced testing called an endoscopic ultrasound. That's actually using an ultrasound probe from the inside to look at things like pancreatic cancer and pancreatic masses. My colleagues, Dr. Newton, Dr. Zeus, do some of those advanced procedures, as well as Dr. Daba, who's in charge of our group.
That is amazing. What an educational experience you're giving me here. And our viewers out there, is there a number that they can call, or is there a website?
Sure, we have our website at northshore.gastro.org. A lot of information's on there as far as diseases that we treat and conditions as far as evaluations that we do and instructions for patients. As far as our main phone number, that's 440-808-1212. That gets us to our main operators and we get you the physician that you need.
I'm here with Dr. Harris, the endoscopy expert. Dr. Harris, my throat is killing me. Just tell me, what do you specialize in?
Well,
when it comes to throats?
I'm a gastroenterologist, and part of what we do is look at the GI tract. And if you're having trouble with your throat, we see a lot of that. We see a lot of patients that have throat problems that are sent to us by ear, nose, and throat doctors, or people that have symptoms of acid reflux and get sore throats. So people with chest pain, and reflux does a lot of things. But we'll look down in there and see if you're having some irritation, see if you have anything serious going on.
My throat's really dry right now, and I'm in a lot of pain. Okay, what type of device would you use to look at my throat?
Our examinations involve endoscopes. We use an upper endoscope, and we'll give you some medicine to make you sleepy. You won't feel anything.
Can you show me what an endoscope is?
Sure.
Boom.
Why don't you follow me?
Yes.
Is that the device that you're going to use on me that Nurse Amber has?
Yes, Amber, come on over.
Nurse Amber, show that device. Show that device to the viewers out there.
This is our endoscope. Now, this device is fiber optics.
Do you mind if I hold it? Can I hold it? This is going down my throat, right?
Just don't use it on me.
I won't, Dr. Harris. So, okay, so what are you looking for when it comes to my throat?
Well, this scope can go down your throat, through your esophagus, into the stomach, and into the small intestines. So we use it to examine the upper gastrointestinal system. We can see the esophagus, see if there's any inflammation there, like you might have with acid reflux, see if there's a tumor there. We look in the stomach, we can find evidence of ulcers, which are holes in the lining of your stomach, gastritis, tumors in the stomach. Look into the intestines, see if you have duodenal ulcers, see if you have any problem with absorption of nutrients, such as with celiac disease. Those are some of the things we see with a scope like this.
What do you see the most on a daily basis? What do patients have? What's the most problem that patients have when you use this device?
Probably mostly acid reflux.
Acid reflux.
That's a very common problem, symptom, disease entity. This is something that there are tons of medicines over the counter because it's always it's a susceptible area to the human body. Reflux is something that can cause many symptoms: stomach pain, chest pain, pain in the throat, cough, hoarseness, nausea, vomiting, trouble swallowing, all those symptoms. So we see a lot of patients that have acid reflux sent to us by cardiologists, lung specialists, ear, nose, and throat doctors. Causes a lot of symptoms.
So this is very high tech and it sees it all.
That is state of the art.
What an amazing device, Dr. Harris. Thank you.
It really is.
It's incredible. Hello, great city of Brooklyn. I am with Dr. Tully at
North Shore Gastroenterology.
How long have you been in Brooklyn?
So we've been in Brooklyn now for about 8 months or so. I shouldn't say that. We were in an office across the street about 2 years ago, and this new office that we're in now is about 8 months old. Brooklyn has been a great location for our practice. The mayor, the city, everyone's been great to, helping us develop the office here and the space. It's really a nice central area to our practice.
I'm 2 years away from 50, but I want to get this procedure started for the colonoscopy.
It's a great idea.
Where do I start?
Listen, you came to the right place. This is a great test to get done.
Okay.
It's a great way to stay out of trouble in terms of colon cancer. March is Colon Cancer Awareness Month, actually.
Really?
So, colon cancer is something out there that's probably not as recognized as it should be. It's one of the more common cancers that arise in the U.S. 1 in 20 people are estimated to get it at some point in their lifetimes. And the nice thing about it is that it can be prevented. Unlike most cancers, if you get a colonoscopy, we can find the precursor to the colon cancer, which is called a colon polyp. Not only can we find it, but we can remove it. And by removing it, you prevent it from turning into cancer. So it's a great test to get done. It's a great way to prevent colon cancer, which can be a very deadly form of cancer, and it is pretty common.
Dr. Tully, my mind is at ease after the consultation. I know I'm in the room. I'm in the colonoscopy room. The room. What should I expect?
All right. Well, no, good question. Right now we're in the pre-op area, where basically you would start your day with us, the day of your procedure. So in these rooms, we basically would have you get an IV started. You're already in your hospital gown. We then put a blood pressure cuff on, heart monitor, oxygen monitor, just to make sure everything's safe during the procedure. We do these colonoscopies while you're asleep. Traditionally, this was done in what we call a twilight state, half awake, half asleep. In our group, North Shore, we've learned that there's a little stronger medication will put you fully to sleep, and it gives you a better experience. It gives us, makes our lives easier, but it also has less side effects, wears off quicker. So the sedation is something that you'll find to be pretty comfortable, which will put your mind at ease.
And the actual procedure is about 20 minutes.
Procedure about 20 minutes long, exactly.
Dr. Tully, I'm so excited for my colonoscopy. Is this the device you're going to use?
This is it. This is it. These are Olympus colonoscopes. These are state of the art, believe it or not. This is an HD quality lens, as I mentioned. There's a little light source here. It's flexible. You can move it up and down, left and right.
Show me that one more time. Look at that. Amazing.
Helps us get all the way around the corners where we need to go. It's all soft plastic. It doesn't have any sharp corners that hurt. It's a common misconception that this procedure is going to hurt. It really doesn't.
So this looks for polyps on that screen right there.
Correct. We blow this tiny lens up onto that huge screen, and we had a real good detailed look at the inner lining of the colon.
So besides polyps, what else do you look for when you're doing a colonoscopy?
Well, if people are having, other symptoms, pain, bleeding, stool problems, etc., we sometimes will see inflammation, ulcers. We can see diverticulosis. We can see hemorrhoids, things like that.
Let me ask you this question. Does PSA have anything to do with colonoscopy? If your PSA is too high? Would that be a sign, like if you're over 4?
That's more the prostate.
It's more prostate, okay.
Yeah. Colon cancer is something that is out there. The biggest risk factor we probably see is, family history of colon cancer. If you have colon cancer in the family or colon polyps in the family, that does put you at a higher risk. It is something that's primarily genetic. It does tend to run in families. It is really related to your DNA mostly, not really related to your diet or lifestyle so much as your genes. So unfortunately, you can't change your genes, but what we can do is just, follow people closer that have a stronger family history of colon cancer, and just keep a closer eye on them in terms of frequency of follow-up colonoscopies. And same goes for folks that have a lot of polyps in the colon or larger polyps in the colon. When we see this, we say, okay, listen, you're a little higher risk. Let's just keep a closer eye on you. And as long as folks get the recommended surveillance colonoscopy, the recommended intervals, the vast majority of them will stay out of trouble in terms of colon cancer. You all right?
Tully, am I in recovery?
Yeah, we're in recovery. Everything went great.
That took like 5 minutes. That was the best sleep I ever had.
Yeah, I'll tell you, you did great. Everything looked fine. And, this is usually what folks tell us is that last thing they remember, we were talking in the room and, here they are, like,
That's amazing.
Nothing lapsed at all.
I was in the procedure room and I woke up here.
Yep.
I didn't feel anything.
Yeah. Yeah, the procedure, it's all gone through the body's natural openings. There's really no incisions. There's no recovery time, really. Sometimes folks, feel a little bit of air, but besides that, there's really not a lot of pain. You're pretty much back on your feet by the next day. You take this day to kind of take it easy, let that anesthesia kind of work itself out of the system, and by tomorrow you should be back to yourself.
Awesome.
Yeah.
That was a great procedure, and I highly recommend North Shore
Gastroenterology.
Dr. Tully and his staff.